the subscription for those who subscribe. Those ones who have not yet subscribed, subscribe, put on notification, and we continue to learn and continue to chase away diseases outside of our lives. Today, last time we looked at the different fungal infections. Where do we get them? How do they present? We saw different diseases, those ones which are on the skin, those ones which go inside the skin, those ones which are systemic. So today we are going to look at how we treat these infections. How we treat them with drugs. And the drugs we use as first priorities are the drugs we call antifungal drugs. And these antifungal drugs, they are divided into categories. According to what they do specifically. So, starting to look at the different categories of these drugs, we are going to see what we call the pollen antifungals. These antifungals, when you take this drug, you take it in your body, it is going to go on the fungus and bind on a chemical in this fungus we call ergosterol, which is the basic chemical in the cell wall of the fungus. It will break it and cause it to die. The examples there we have nystatin, we have amphotericin B. Those are the drugs we can use. Nystatin, we can use it for oral candidiasis, and amphotericin, we can use it in what we call cryptococcal meningitis associated with AIDS and other conditions like systemic fungal infections for amphotericin B. When we look at the second group, those are the azoles, and these ones. So the azoles, their function is they go and bind on enzyme we call cytochrome P550, which is a 14-alpha sterol demethylase enzyme. This enzyme is involved in conversion of lanositol to ergosterol. Ergosterol, we said, it is the basic component of the fungal cell wall. So the drugs here are divided into two. We have the imidazoles and the triazoles. In imidazoles, we have ketoconazole, clotrimazole, we have cetaconazole and miconazole as the commonest drugs we use in clinical use. Then these ones have fluconazole, itraconazole, and voriconazole. Those are the triazoles. How do they work? By blocking this enzyme we have seen up here. But we can use them in different conditions, different fungal infections. So, we have seen the azoles. The ketoconazole and miconazole are superficial. We can just smear them on the body for those who are having ringworms, and the clotrimazole also. Those ones who have ringworms and skin fungal infection, but also ketoconazole is present in the tablets. You can take tablets, but these drugs have side effects and interactions. Ketoconazole requires gastric acid for dissolution. So for a person who is taking antacid drugs for ulcers, when you take this drug, it won't work well in your body because you are suppressing the acid in the stomach. So it is also related to impotence in men and in decreased libido. Once you're taking this drug, you have to be conscious. Fluconazole is a broad spectrum antifungus and it can cross the blood-brain barrier. So we have seen the azoles. The ketoconazole and miconazole are superficial. We can just smear them on the body for those who are having ringworms, and the clotrimazole also, those ones who have ringworms and skin fungal infection, but also ketoconazole is present in the tablets. You can take tablets, but these drugs have side effects and interactions. Ketoconazole requires gastric acid for dissolution. So for a person who is taking antacid drugs for ulcers, when you take this drug, it won't work well in your body because you are suppressing the acid in the stomach. So it is also related to impotence in men and in decreased libido. Once you're taking this drug, you have to be conscious. Fluconazole is a broad spectrum antifungus and it can cross the blood-brain barrier. So the allyl amines, This one inhibits the enzyme we call squalene epoxidase. It is also involved in cellular synthesis of the fungus. The examples we have here, they inhibit squalene epoxidase enzyme. Say the example and the commonest drug is tabinefene. Is the drug of first choice for treating what we call cutaneous fungal infections. They can penetrate the skin, the nails, and they can also be found in breast milk. So we have a disease called onychomycosis. When we talked about it in the fungal diseases, the videos are. So this one is the best drug of choice, tabinefene, and the dose can be prolonged to almost 3 months to treat these infections. We have others. We have what we call echinocandins. This one is the inhibit the 1,3 beta. So we said the dosage depends on the age of the patient, the sex of the patient, and the state of life of the patient. When a patient is having neurological disorders, we don't give ketoconazole. If a patient is having hepatic condition, hepatic impairment, we don't give amphotericin B. So we depend on the condition, lifestyle of the patient. How is their life, and their age and their sex. Thank you very much.